we were able to implement that integration, and it's just been a game changer for those individuals.
Can you tell us a little bit about the automation played in your organization?
We are using, so for our side, what led us to Kazumi and to you all was internally, I am driving nursing home work across the United States. So we have so many sites, so many parent organizations, so many states, different state accrediting bodies. And we utilize Salesforce from a CRM perspective to organize ourselves and understand where my resource teams, my operations teams need to be deployed, what touch points that we were having. And then under that, we work with the government for some large funding contracts. And there are a lot of associated deliverables with that we have to make sure that we maintain in order to receive the funds under those contracts. So we have Salesforce for our organization and contact management side of the house. And then we have been using Constant Contact for our mass email efforts, web email registrations, podcasts, things like that. But we were really missing the boat in looking at our contacts and our clients from a 360 perspective, meaning we have one system that's housing a lot of the demographic data about the individuals. We have another system that's catching all of our touch points with that individual, but the two were not talking.
I see.
And so for my team members that are deployed on site across the United States, they were walking into nursing homes with no understanding of if other people at our company had talked to them. Have they logged in? Have they looked at our podcast? For COVID in particular, have they downloaded the CDC toolkit? Have they tried to train their staff? What are their infection control policies, and what tools of ours have they utilized and implemented so that my team members would have an understanding of where that facility was sitting so that they could garner and provide the best health and QI experience for them. So that led us on a fact-finding mission of how we can get these two systems to talk, which led us to you all, Kazumi. And so we were able to implement that integration, and it's just been a game changer for those individuals in particular that have to go into the facilities. At the frontline level, you have to think about nursing home staff. They have been dealing with 2 years of death, of regulations that have been coming down left and right, of state surveyors that on top of that come in and fine them. They have the highest turnover that industry has ever had in the history of the United States right now. So they constantly are either short-staffed, having agency come in, or not having enough staff to meet the needs of the residents that they have. So my point with that is they are really, really taxed and they are tired, and time is the most precious commodity. And so enabling our team to be able to have an understanding and do the background and legwork before they walk in so that they can provide exactly what those individuals need at the right time without having to go through discovery and ask them questions and a lot of things that would impede on their time has just been, I can't tell you how well it's been received by our nursing home providers in particular.
If you like what you saw and you want to listen to the full episode, just click the link below and enjoy.